Hello everyone, I'm Dr. Bloem and welcome back to my channel where we explore cutting-edge approaches in integrative and holistic medicine. If you're new here, make sure you hit the like button, subscribe, and click the notification bell so you won't miss future videos. And as always, I'd love to hear your thoughts in the comments below. Today we're talking about chronic kidney disease, a condition that affects millions of people worldwide. And I want to introduce you to a patient named William, who is living with chronic kidney disease and currently undergoing dialysis. His journey is one that so many patients can relate to, struggling not only with physical symptoms, but also with the mental and emotional toll of regular dialysis treatments. But here's the exciting part. There are integrative strategies that can make a big difference in quality of life, symptom control, and even long-term outcomes. My colleague, Dr. Robin Rose, has shared some fascinating insights, and I want to break those down for you in this video. Diet and nutrition. One of the most powerful tools for kidney health is diet. For William, this meant moving towards an 80-20 model. 80% plant proteins, 20% animal proteins. Why does this matter? Because excess animal protein can stress the kidneys, while plant-based proteins are generally gentler and provide key nutrients. William also learned to carefully manage potassium and phosphorus levels, since too much can cause serious complications for kidney patients. If you're living with chronic kidney disease, always work with your healthcare provider to monitor your labs and adjust your diet accordingly. Question for you. Have you or a loved one tried adjusting protein intake to improve kidney health? Share your experience in the comments. Supplements and detox support. Dr. Rose mentioned several supportive supplements: bicarbonate, baking soda, a simple, affordable way to help alkalinize the body and balance potassium and phosphorus levels. Acacia Senegal, a natural fiber, helps bind toxins like creatinine and uremic acid in the gut, essentially letting your digestive tract do some of the detox work that your kidneys can't. Zeolite and other binders used to reduce heavy metal burden and other toxins. Carnosine, a small peptide that can bind toxic metals like mercury, lead, and cadmium, while also supporting kidney and cardiovascular health. These are not one-size-fits-all solutions, but for some patients, they can be game changers. Bioregulators and peptides. Here's where it gets really cutting edge. Bioregulator peptides are short amino acid sequences that can signal your body's cells to repair and restore function. For kidney patients, options may include kidney bioregulator peptides, parathyroid peptides to help manage phosphorus levels, vascular peptides to support blood vessel health, pineal peptides which may improve sleep, something William struggles with, retina peptides for eye issues linked to diabetes and kidney disease. It's beyond the scope of today's video to go into detail about each of these peptides, but know that they can often be used safely even in advanced kidney disease. And yes, our clinic can order them for patients when appropriate. Lifestyle strategies. William also works hard on lifestyle changes. Exercise. He walks 2 to 4 miles on non-dialysis days and swims in the indoor pool for gentle resistance training. Exercise helps maintain muscle mass, improves mood, and supports circulation. Infrared sauna therapy. This can gently support detoxification, but should be used carefully and gradually. Sleep and stress management. Kidney disease often keeps the body in a fight or flight mode, raising nighttime blood pressure and disturbing sleep. Techniques like 4-7-8 breathing, inhale for 4 seconds, hold for 7, exhale for 8, can calm the nervous system. Another practice is 4-16-8 breathing, which uses longer exhalations to further reduce stress and blood pressure. Simple, yes, but incredibly powerful. Lab testing. To guide care, we also recommend specialized lab tests that go beyond standard panels. For example, homocysteine and ADMA, markers of vascular damage. Heavy metal testing to see if lead, mercury, or cadmium are stressing the kidneys. Organic acid testing for mitochondrial health, fungus, and oxalate overload. These tests help us uncover hidden drivers of kidney damage that conventional nephrology may overlook. The cutting edge of hope. Here's the key takeaway. Even if you're on dialysis, there are steps you can take to improve your quality of life and possibly reduce your dependence on dialysis over time. Nutrition, detoxification, supplements, peptides, exercise, stress management, all of these tools can make a real difference. Conventional medicine sometimes says there's nothing more we can do, but I want you to know that's not the end of the story. Integrative medicine opens new doors, and I'm committed to walking through those doors with my patients. If you found this video helpful, please hit the like button, subscribe to the channel, and share it with someone you know who's struggling with kidney disease. And I'd love to hear from you. Which of these strategies do you think would make the biggest difference for you or your loved one? Leave your answer in the comments below. I read every one of them. Together, let's spread hope and healing. I'm Dr. Bloem, and I'll see you in the next video.